I am joined here with Farah Boyer, who has worked in the admissions area for quite some time, and she is serving as the person who will be monitoring the chat room and helping to field questions this morning. Let me just ask you, if in the chat room, if you would you just type in what health-related career you are interested in? And that will help us to know who's in our room with us. As has been stated here and on this video, we offer 11 different health careers here at MassBay Community College. And then we offer one non-credit program, and that is our CNA program. And this is an excellent time to go into health careers. If you can imagine, we're in the middle of a pandemic, but what you've seen in the middle of this pandemic is there is such a great need for healthcare professionals to be able to care for those who during times like these and other times, even non-pandemic times, can't care for themselves. You will find that health careers are among the fastest growing careers in the nation and even here in the Commonwealth. And one of the things that I'd like to let people know, because this is something that tends to escape people, is that we have scholarships available specifically for health sciences. There are times when individuals they're just trying to get their feet wet into the field of healthcare. And so they may say, I just want to take a one-semester program and see if I can do this. You may be coming right out of high school. You may be changing careers. You may be someone who feels like, I'm older. Can I even do this? Are there even older individuals going into college at this time? And the answer to all of those would be yes, yes, and yes. We have students of all ages and diversity across the board going into healthcare, people who are changing careers because they've decided that whatever it is they're doing, what they really want to do is help people. And I guarantee that if you're interested in health careers, you probably will be able to find something at MassBay Community College that will be exactly what you wanted, or it will at least start you on your way. And let me go back and talk about those scholarships. We have scholarships of $75,000 devoted just to those who want to go into a health career. And so we'll talk more about that at the end. This is what I'd like to do. I'm going to share my screen, and I'm going to talk about some of our programs. Hopefully you can see. All right. Hopefully you can see my screen. If you can see my screen, just nod your head. Anybody, everybody, thank you. All right, I'd like to talk just a little bit about the careers that we offer here at MassBay and elaborate a bit from the video. And I mentioned that we have some one-semester programs. And so we have a central processing technologist program. Those are the individuals who help to prepare instruments for surgery and then clean them after surgery. It's a one-semester evening program. So in one semester, during the evenings, you'll have lecture, lab, and then you'll go on to clinic, actually working in the hospital environment, and doing a job that is so central to surgery. Surgery cannot be done without these individuals. And we accept up to 15 students each semester, every fall, every spring, every summer. And this is a job in great demand. All of our central processing technologists who complete the program and pass the national exam, they are in high demand, and often they are employed by the places where they went for clinicals at. So that's one program that we offer. Again, 1 semester. This is often a gateway program, and then I'm going to drop down to surgical technology at the very bottom to our surgical technology program. The surgical technologist is the individual who is often standing right next to the surgeon in the operating room, passing instruments, making sure the sterile environment remains as it should be. There are so many other things to that job, but in one year, a person can become a surgical technologist. This is a certificate program. And so often the central processing technologist will start with that 1 semester program and then decide, I want to go on. I want to become a surgical technologist. And so in 3 semesters, i.e. 1 year, you could become a surgical technologist. Let me come back up to the second one, the certified nurse assistant, or the CNA, as we call this individual, or the nurse assistant. The CNA, or the nurse assistant, this is our non-credit program. But in 8 weeks, you can become a nurse assistant. This program, there's the lecture part of it, the lab part of it, and then the hospital where you go and you do your training in a hospital environment. There is a high demand for nurse assistants. And sometimes people will do this 8-week nurse assisting program, and then they'll decide they can work part-time or whatever hours they want as they go on to do the next thing that they want to do in the area of health careers. And so consider our certified nurse assistant program. And Sarah Boyer, who is our tech assistant today, also oversees that nurse assisting program if you want to ask more questions. I'm going to come back. Computed tomography, this is an advanced certificate. A person has to be in the imaging sciences, have graduated from radiography or radiation therapy or nuclear medicine before they can go into the computed tomography technology field. We have an EMT program and a paramedic program. Our EMT program, in 1 short semester, you too can become an EMT. We offer it every fall, every spring, every summer. We offer it in the day and we offer it in the evening. The same is true for our paramedic program. Every fall we start a class, every spring we start a class. And it's a 1-year program for paramedicine. It's a 1-semester program for EMT. You have to be an EMT before you can go into paramedicine. And if I didn't say it, both of these, we offer these programs in the day, we offer these programs in the evening, depending on the semester. People always say, is your nursing program still there? Do you guys still have a nursing program? I'd like to say that our nursing program is alive and well, doing great. We have a licensed practical nursing program. It's a certificate program, a 1-year program. It starts every fall. So our students start in the fall. They go through the spring and through about half of the summer, and they complete with a certificate. It's called the Licensed Practical Nursing Program. And then many times our students go from being an LPN, that's what this is typically called, to then moving into our associate degree nursing program. This is down here, and we call it the registered nurse. So this is the associate degree nurse, the RN, that's down here, and that is a 2-year program. Many times our students will go either just right into the registered nursing program, or they'll stair step it and do licensed practical nursing, graduate, complete that program, sit for the national exam, pass it, and then continue on in the RN program. And then after they complete the registered nurse or the RN program, then they'll go over to Framingham State or somewhere else to complete their bachelor's degree. We are an affordable program in nursing here at MassBay. Sarah, I know you'll keep me in contact with my time, and I'll run through the rest of these and then catch any questions that may be on the chat, okay? And then we have a medical coding certificate program. These are the individuals who make sure that billing happens correctly. You go to a doctor's office or a hospital, you have procedures done. Well, how do you get the bill, and how is that? Do they determine how much you're going to pay for that visit? Those are the medical coders, and that is a 3-semester evening program. And then we have a medical office administrative assistant program in 2 semesters, and this program is online and remote. So some of the classes right now, if we weren't in pandemic times, it would be face-to-face. Right now, it is a remote program. But in 2 semesters, you could work in a physician's office, a doctor's office, a medical office, and be on the front end of the medical office administrative assistant end of that role. And then we have a 1-semester phlebotomy program. We offer it every semester. Right now, because of the pandemic, we're determining whether we will be offering it in this coming spring or not, but a phlebotomy program. And then often people will complete the phlebotomy program on their way to applying for the nursing program or radiography or EMT or paramedicine, so that they can work having a marketable skill while continuing on to do the next thing they may want to do. Our other associate degree program is our radiologic technology program, i.e. radiography. These are the individuals who, when you go into the X-ray department, the imaging department, sometimes called the radiology department, these are the technologists who actually are taking pictures or images of your body. It's an associate degree program. It's a 2-year program if you take it during the day, and it's a 3-year program if you take it during the evening. So we offer it in the day and in the evening as well. And then I mentioned our registered nurse program, and then I mentioned our surgical technologist program. So I'm going to quit sharing right here and ask Farah to take us to the chat room to see what questions are here.
Sure. So if you have a question regarding the health science programs, please place it into the chat box or unmute yourself. I am going to quickly, because we are at 10:21, I'm going to place the link. So if you're interested in going, we've had 5 or 6 people who are interested in nursing. There is going to be a breakout for nursing. So please check that out. I'm going to put the link in there now for you. And then if you have a question, enter it. I do notice that we do have Professor Clark here with us, who is the chair for surgical tech and central processing. And we have 3 or 4 people who are interested in surgical tech and central processing. So Rich, do you want to give us just a little bit about that? And then while students kind of navigate their way through and think about the questions that they may have.
Okay. Hi. Glad that you're here. I'm glad to offer or answer any questions. Surgical technology is an extremely exciting career field, and it's growing all the time. I notice since the pandemic has happened, there are unbelievable amount of jobs that are open. So now is a very good time to get into the career field. And at MassBay, we train you to be surgical technologists, and almost everybody who goes through the surgical technology program gets a job. Does anybody have any questions?
People are asking about central processing technology, Rich. Can you give us a little information about that? Oh, you're muted. There you go.
I do that all the time. As Dr. Davis said, it's a 1-semester program. And it's almost all of our students who go through central processing get a job. Central processing is, I've worked in central processing before because as a surge tech in the Air Force, we were trained to work in central processing. And I spent some time, we rotated through there, and I spent some time in central processing. I spent some time running central processing. That too is a really exciting and rewarding career. It oftentimes people like central processing and they end up staying in central processing. But it is a good lead off jumping into surgical technology. We've had lots of students who came from central processing, worked in central processing while they are going to through surgical technology program, because central processing is very flexible in their hours, and that's what you need when you go through surgical processing. You're basically, you're decontaminating the instrument. You're oftentimes you're supporting surgery. That's one of your biggest, but you're also supporting the entire rest of the hospital in providing sterile equipment.
Let me jump in here. There's a question about radiology. To my knowledge, there is not a specific breakout room today for radiology, but if you have a specific question, feel free to unmute yourself and ask the question that you have regarding radiography. And I realize that are we at time?
We are at time. So if others are planning on joining the programmatic info sessions, that includes nursing, new degrees in substance abuse, our political science, automotive, I believe as well. You can go ahead and click on the link that is in the chat box, and it will take you back to the main screen. Otherwise, if you have time, then you can stay in here while we just go over a couple other things. Ask your questions, put them in the chat box, and we'll try to answer them the best that we can.
Yeah, thank you so much for being here with us this morning. And if you have any other questions, what can they do next if they have more questions but they don't want to ask them right now, Sarah?
So you can go to, there is also an admissions chat room as well if you want to have specific questions about the admissions process. That's probably where I'll be heading after this presentation. If you have specific health science programs, I do work as the coordinator for the surgical tech program, the central processing technology, the EMT, the paramedicine, the rad tech, and the computer tomography. So I could answer some questions in here for the remaining 5 or 6 of us that are here. And then it is always lovely to have your department chair in this room as well, and your dean. So I think you have 2 people who are experts in the field, and I can help as you see fit.
Excellent. Thank you. See you guys later.